Hi, I'm Angela Lackey, author of Surviving Ed, the Eating Disorders Recovery blog for HealthyPlace.com. And I'd like to start out by saying that this video post was inspired by another Healthy Place blogger, Natasha Tracy, who is the author of Breaking Bipolar. She recently wrote a post called Bipolar Disorders Caused by a Bad Childhood, in which she disputes that having a bad or traumatic childhood is the cause of bipolar or other mental illnesses. Um, as I read her post, I got to thinking about the different things that I have heard about the causes of eating disorders. Some of the fallacies, particularly surrounding parents. Probably, I would say 30 or 40 years ago, the idea was that the eating disorder was caused by a cold and distant mother. Many mothers were told that they were the cause of their daughter's eating disorder. At that time, they were not looking at boys having eating disorders, but I'm sure that there were, but I digress. Anyway, the idea was that the mother was cold and distant, and the daughter was perfectionistic and wanted to please her, and these dynamics helped create the eating disorder, whether it was anorexia or bulimia. But, as we have moved on and studied eating disorders, we have discovered that there are a multitude of causes for eating disorders, and I don't think that we can say that there's any one cause of eating disorder. I think for me, I believe it is unique to each person, the cause of our eating disorder. However, I do realize that there are those within the eating disorder community who believe that genetics play a large role, and that you have to have a genetic propensity toward developing an eating disorder. I know that they're still doing studies about that. And I find that interesting, and I think that genetics probably does play a role to having an eating disorder, and why I developed an eating disorder, because I suffered from depression and anxiety prior to developing anorexia. So I obviously had some mental illness genetics going on there anyway. And then I developed anorexia when I was 42. And found it to be a way to handle stress and handle anxiety and get through life. There are many things that anorexia was a great coping skill for a long time, until it stopped being a coping skill and started being a liability and a problem and an illness where that made me too sick to work and things like that. But okay, back to the causes of eating disorders. I think that right now we still, again, aren't clear on any one cause. And I think that what we're going to find out is that there are several causes, and that ultimately each person and why they develop an eating disorder is as unique as the manifestation of the eating disorder within them. Thank you for listening, and I hope you read Surviving Ed. And again, I would encourage you to also look at Breaking Bipolar and the recent post about bipolar disorders caused by a bad childhood. Thank you.